Hello and welcome to HSM 430. For today's class, we are discussing foundation of values and ethics of interprofessional practice. There are three learning objectives for today's class. We are describing the four competencies of interprofessional collaborative practice, differentiating ethics from values and ethics from bioethics, and finally describing steps of interprofessional ethical decision making. So starting with the competencies, there are four competencies in interprofessional collaborative practice, and you can learn more about these core competencies here. I'm going to talk about them, but just if you click on this, it's going to show you, tell you a lot more about what these core competencies are. So, we have values and ethics. We have roles and responsibilities for collaborative practice. We have interprofessional communication, and then we have teamwork and team-based care. So this is what that looks like within the setting of community and population orientation, and it needs to be situated within patient and family considerations, being patient and family centered. So we have talked about interprofessional communication in the first module, and then we talked about team work and team-based care in module 2. And then for this module, we're going to focus on values and ethics. So roles and responsibilities we are going to touch in along the way as we talk about along the way of this course. There's not going to be any specific module that is going to focus on that, but we're going to touch on it throughout the course. So what are the definitions of these competencies? So starting with values and ethics for interprofessional practice, it is described as having individuals work with, having healthcare professionals or members of an interprofessional team work with individuals of other professions to maintain a climate of mutual respect and having a shared value. Then the second competency is of roles and responsibilities, and is for members of an interprofessional team to use the knowledge of their own roles and those of their other members of their team to appropriately assess and address healthcare needs of various patients, and also to advance the health of the population. The third competency is looking at interprofessional communication, and it is seen as being able to communicate with patients, families, communities in a responsible manner, and that supports the team approach to how they are promoting and maintaining health. And then finally, the fourth competency of team and teamwork is, it calls for healthcare professionals to apply relationship building values and the principles of team dynamics to effectively form different team roles in order to plan, deliver, and evaluate patient-centered care programs and policies. So let's go into talking about ethics and values. So there is a difference between ethics and bioethics. Let's start by discussing what ethics are. So ethics has been defined as the rules and principles that govern right conduct. But the thing is, when it comes to thinking about it, what right conduct is differs on setting. Right conduct can be quite contextual in the sense that there are quite a number of things that will be considered right conduct in one setting and not be considered a right conduct in another setting. So this is where the rules and principles come in. So these is the rules and the principles that determine what a right conduct is within the setting that is being specified. So rather than in general. So for the most part, what right conduct is not general. It can be quite specific or applied to context. So a code of ethics will be those set of rules and principles, or what that detect what an expected behavior is. So we made rules and say this is what a right conduct is, and they become those moral principles in which we are meant to then model our behavior. So that is what code of ethics would be. And then bioethics, in contrast, it's not a completely separate thing for what from ethics. It's just that bioethics kind of focuses on biological sciences, medicine, healthcare practice, and research, and has been defined as the identification, analysis, and resolution of ethical problems, issues, and dilemmas. So while we can use the term ethics in the sense of healthcare and healthcare professionals, when we say bioethics, bioethics is specific to health related stuff, or life science or biological sciences. So they're not exactly interchangeable in the way that you use them. So bioethics also looks at the studies of the philosophical, social, and legal issues that arise as a result of medicine and life sciences. It also investigates and studies how health decisions are made. An example would be looking at what end of life care is, conversations about medical euthanasia, and allocation of medical resources. So there could be some arguments to be made whether medical euthanasia is good or it's bad, or there could be some arguments based on how do we allocate medical resources, who should get it first, who should get it the most. So this is where bioethics all come into play. So as healthcare professionals, the way that we are trained, or the code of ethics that influence us as healthcare professionals does kind of work its way into making us have some shared values as a result of that. So you have, for the most part, a lot of medical professionals who have been trained in the traditional way, having very similar shared value. One of those that is quite very popular is the do no harm. That one is the one that even if you have not graduated from medical school, you know that do no harm is very much at the core of the value of healthcare professionals. And part of that value is asking healthcare professionals to weigh what, and that has to be given in terms of ideas, attitude, customs, or objects. So it helps us in determining the weight of ideas, of attitude, of customs, and stuff like that. So that is all parts of our training. It does shape our worldview, and in determining perspective, you would find that in if you have been surrounded a lot by healthcare professionals, and then you go into a different profession and you see that the way that they approach things might be quite vastly different from the way that other healthcare professionals do. For example, while as healthcare professionals we've been it's been drummed into our head to do no harm, that may not be the principle on which other profession operate, but because this is what our training has done for us, it has shaped our world view about how we are interacting with the world. It also does form for us foundations of judgment, of decisions we make, or the actions that we take. So that comes from the training, medical training, that does try to impact these values. So, and you will see that a interprofessional practitioner that has been trained in interprofessional collaboration and practice is going to approach interprofessional teamwork in a different way from a person who has not received the training. The trained healthcare worker is going to be more open to shared values, about interprofessional collaboration more than the person who has not been trained on that. So, the healthcare professionals' biomedical view of life, like I said, is something that is for a lot of time acquired through our education and our training. And what it does is helps us to recognize that, biomedical view can be relatively narrow. When I say relatively narrow, this is not to say that our worldview is narrow. It just means that many people outside the professional may not share the same worldview. I'm going to use an example of seeing a homeless person, for an example. Someone who has been trained in social determinants of health, when that person sees someone who is homeless, they're not going to think in a very linear way like, oh, this person is homeless because they are lazy or something like that. They're going to think about it in a much broader way that says, oh, there are a lot of social determinants of health that are coming in that may make it difficult for this person to find a job, to have health care, or if they have bad teeth. This is all the factors that could be playing in. So while our view may be broader in the way that we are looking at things, the thing is that there are not a lot of people that will share that view, because we have received training on that and therefore are able to see things in that way. People who are outside that training and education are less likely to have those views. And this includes patients, including their families and their friends. So you might find, as a healthcare professional, something that makes complete sense to you is something that your patient or their family just doesn't agree on. And you could be making advice and saying, this is good for you, but the patient or the family, they are not coming from that same perspective, and so they are not seeing what it is that you are seeing. So how do we then do ethical decision making in situations where they are tricky, or we have patients or their families who don't see things in the same way that we do? So I'm going to talk about ethical dilemma because it's something that as healthcare professionals we kind of we come across and have to find a way to solve it because they are quite very tricky to solve. So ethical dilemma is situations or dilemmas in which the solution is not obvious, or it has multiple rights or ethical solutions whereby there are multiple ways that you could do this that is considered right or ethical, but you can't all do this, take that solution. You will kind of have to pick which one to go with and then the others to drop. The decision of how to get to that, to make that solution, to pick that solution over all the others, is what breeds the ethical dilemma. So what happens as a result is there is conflict between all the alternative solutions, and so such that in a situation whereby no matter what a person does, there's always some ethical decision that may end up being compromised. So there are multiple right things to do, but you can't all do those multiple right things, and sometimes to be able to do some right things, you're going to end up compromising an ethical principle. So oftentimes it is a no-win situation. There is no decision that you take that is not going to have that is not at risk of having an adverse consequence. So those are what you have to bear in mind. An example would be the do not resuscitate order that was made for COVID-19 patients at the very height of the pandemic. So the idea behind the do not resuscitate order was for healthcare professionals to do everything that they can to save patients, but they are not supposed to do that at the expense of their own health. So there need to be minimal health, a minimal risk to the healthcare provider, and of being infected with COVID-19, even if it means at the expense of the patient, or in this case the patient dying. Now, this I have a kind of real life experience with the do not resuscitate. This is very much at the peak of COVID-19. My mother got COVID and she got into the ventilator when she was in there for a couple of weeks. And the hospital had tried many remedies, regimens, and it just wasn't working. And so they wanted to sign the do not resuscitate order. So how the do not resuscitate order is that, the patient needs to kind of sign off on it. But in the case of COVID, most of the patients were not in the state of mind to be able to sign off. And so what happened is that you had a lot of family members making that decision whether to sign off on the do not resuscitate order. In my mother's case, my sister, who was her next of kin, refused to sign the order because she didn't want, naturally you don't want your family to die, and so she didn't sign off on that. And the hospital was willing to honor it, but for a time. So it had to be that they would get to a point whereby, even though she had refused the order, they would have gone ahead and put that in place. So that is a sort of a no-win situation, because my sister at this point was a healthcare worker herself, meaning that she also has to see herself in the sense that if she was the one who was taking care of a COVID patient and the family refuses to sign a do not resuscitate, that could be them risking their health. But at the same time, she has to be conscious of the fact that she doesn't want to lose my mother, and therefore she doesn't sign the do not resuscitate order. So this is how ethical dilemma can happen. Not all ethical dilemmas are life or death situations, but some of them can be. So healthcare professionals are often faced with ethical issues, and this can also arise with happening within the interprofessional team, whereby everybody has differing values. Just because we are all trained, we receive medical training of some sort, doesn't mean everybody holds the same value on every topic. So you would always find some having different views or different values on some things, and sometimes the healthcare professionals will have a completely different value system from the patients, that may hinder the patient's ability to self-determine their health. So this creates ethical dilemmas as well. An example would be a cancer patient that requests a physician-assisted suicide or medically assisted suicide. So even in places where it is legal, you may not find all clinicians that are willing to perform it. So in this case, you have the clinician value being being contradictory to the patient's value. So, but the question is, what do they do? Do the physicians say, I'm not going to perform this, go find a physician that will agree to do that? Or can the patient be talked out of it? So it can create a very dicey situation. And then what if there are members of the interprofessional team that supports medically assisted suicide, and there are those that don't support it? Meanwhile, the interprofessional team has to make a has to make a decision as a team. How does that conversation happen? How do they come to a final solution about what to do? So you can imagine how that conversation is going to go. So the key to reaching decisions about ethical dilemmas is for interprofessional teams to be able to interact in such a way that they are all geared towards resolving the problem, and that requires a very high level of team collaboration. So if an interprofessional team does not have high levels of collaboration, that may take it longer for them to reach a decision versus those that do have collaboration. So, but what to do if you're in a situation like that is to reflect on your own personal and professional value, is to identify how your values and those of your team members may impact the functioning of the team, and your ability to make ethical decisions, but you also need to trust your team members, and because this way it's going to aid this collaborative decision making. So to be able to make ethical decisions, particularly in a ethical dilemma, you need a circle of trust. So circle of trust, a couple of things to consider in it, or to make it possible to have circle of trust. The first is to be open to trust, have an openness to trust. You need to be willing to delegate. You need to have, the team needs to have shared decision, being able to make shared decision and agree that shared decision making is something that is important and critical. Every member of the team also needs to feel valued, and they need to have a sense of involvement in the decision that is being made. These are all things that needs to be there for there to be ethical decision making in a seamless way, or relatively seamless, within an interprofessional group. So there are a couple of principles that help in making ethical decisions, and these are the ethical principles. We have autonomy, that says all human beings have the right to decide what's best for them. We have beneficence. Healthcare providers must actively secure the well-being of the patient. Non-maleficence, do no harm. Something that we know very well. And then you have justice. Justice is very much rooted in the principle of fairness. Healthcare professionals are responsible for protecting the vulnerable patients and vulnerable population from exploitation. And then we have fidelity, which is that once you have initiated health care to a patient, to a population, do not abandon them. Try very much to see through to solving their problem. And then we have veracity. Veracity is truth telling. Sometimes in a situation whereby a healthcare professional has a different value from the patient, but knows that by telling the patient everything, that patient is going to end up making decision that goes against the value of the healthcare professional. There may be a temptation to kind of hide some truth or not tell some things. Now, to do something like that would be going against this ethical principle of veracity. So it's something to pay very close attention to. So how do you make ethical decisions? So you want to start by determining the decisions to be made, and then go all the way to evaluating the outcome of the decision. Of course, after you have evaluated the outcome, that does not that's not where it necessarily ends, because the outcome can create situations in which decisions has to be made again, and then we go through the entire cycle. So there's really no start and end with ethical decision making, because remember, systems thinking, they all have knock-on effects on everything. So it's kind of a process that keeps going on and on and on. So, and at the heart of ethical decision making is what we call distributive justice. So the principle of distributive justice is to address the concept of what fairness is and what equality is. So distributive justice, it tries to focus on equitable distribution of limited resources. So healthcare, there's a limited number of financial expenses that can be made. There's a limited source of time that can be spent on patients or population. There is, of course, a limited number of healthcare workers that are able to provide care to everybody. So that means that there has to be some decisions to make on who gets what and to what amount or quantity that they get it. An example would be in the COVID-19 vaccination, where decision was made that healthcare workers and the elderly would be the first batch of people or population to receive the vaccine before everybody else. And this is an example of distributive justice, because this population were considered those who were most at risk. And this is because the elderly had the highest mortality rate. They were more likely to die from COVID than other population groups. So they were at most population. And on the other hand, healthcare workers were very critical in solving the problem. They had to be the ones to take care of people, and so you kind of want to keep them alive and to keep them well, because in having a lot of healthcare workers having COVID, that would mean that many more people who get COVID will not be able to survive. So that is an example of distributive justice. So the concept of distributive justice comes from John Rawls, and in his book called The Theory of Justice, that was published in 1971. And he says that what happens when demand outstrips resources? What if there are 10 intensive care beds and there are 10 ventilators, and however there are 20 patients who need to use the ventilator? How do you as healthcare workers decide who gets the ventilators? Do you do that by a lottery? If you throw the coin in the air, if it's heads, you get the ventilator. If it's tails, you don't get ventilator. Or do you have other factors that you need to consider? Example would be who is likely going to survive if we give them the ventilator, which is something that happens a lot in considering who gets organ donation. And then also having questions like, does it matter the patients that have young children or not? So those are questions that do come up when you are making decisions about distributive justice. So this is where we end for today's class. As always, do remember to use the Q&A board to ask any question, or if you need any clarification. Do have a lovely day. Bye.